I wake up this morning, I'm very, very tired. I feel as if I work overnight.
Their brain has not rested. Depression and sleep, they are like this. They're like 5 and 6. The more you subject yourself to poor sleep, the more risks of anxiety and depression.
You can sleep, but your brain may not follow you.
Yes. Some eat straight and go to bed straight.
What are things that alcohol can cause?
The brain prefrontal cortex releases some hormones. So it's advised to eat an hour before bed. Yes, sleeping too much is a sleep disorder.
Snoring has caused a lot of people their marriage.
The kind of pillows you use. Snoring is caused by obstruction.
Finding it difficult to sleep can cause what?
Depression, anxiety,
High blood pressure.
yes.
This podcast is sponsored by Exodus Holistic Clinic.
Hi, I'm Bankole Christiana. I'm a sleep therapist.
Welcome to the show.
Thank you so much, sir.
Why is sleep so important for us?
Sleep is very important to us because it's a vital physiological process that helps the body to rest, restore, and rejuvenate.
We have different cases where patients will be like, barely sleep, like 1 hour, 2 hours, something will wake them up and they find it difficult to sleep again. What are things that can cause this?
Okay, so there are several causes, but I will say this. Sometimes these patients put this upon themselves, and sometimes it can be drug-induced or environmental factor like Nigeria, our economical factor. So the self-induced one is that the patient puts in so much pressure on themselves, forgetting to prioritize sleep. Some even take alcohol close to bedtime. Some take caffeine close to bedtime. Some, they just go to bed and they end up waking up later in the midnight after 2 hours, 3 hours, and they can't get to sleep. Some, they don't engage in relaxing activities before going to bed. Some eat straight and go to bed straight. They don't even allow the food digest. And some, they don't even check in their sleep-wake cycle. Like the time they sleep, the time they wake up is not even consistent. So those are the self-induced ones. Why others can be drug factor, maybe they're on a medication, or the environmental factor, the economy, so much pressure from outside. And yes, then in children also, in teens especially, during the evening, their circadian rhythm shifts towards that time. Normally, they are supposed to sleep in the evening, but their circadian rhythm shifts towards the night, making their sleep time late, like 10, 11 p.m. Some even at midnight. And this affects them greatly because they have to still wake up early to go to school. And they start being grumpy and very tired in the morning.
Wow. Thank you. Let's talk about the fact that you mentioned alcohol.
Okay.
Because a lot of people believe that it is when they take alcohol that they feel more relaxed. What are things that alcohol can cause?
What alcohol does is basically internal. Some people take alcohol and next thing they doze off, but the thing is that their brain is not fully relaxed in that state. They will think they've slept, but when they wake up, they start feeling headaches and
tired,
very tired. So they've not gone through deep sleep.
Wow.
That is why they've not gone through restorative sleep.
I like the fact that you open it to us that you can sleep, but your brain may not follow you.
Yes.
Wow. So what's now the difference between normal sleep and deep sleep?
Okay, will I say normal sleep? I won't say normal sleep. I'll just say sleep, then deep sleep.
Okay.
Because if you want to have the full sleep, you have to go through the complete cycles. It takes about 90 minutes approximately. If you want to go through the full sleep, you have to pass through deep sleep. Your brain has to rest. Your body has to shut down, relax. So yes,
economy.
Yes, that is sleep. So in that sleep, you have deep sleep. That's why I'm not calling it normal sleep.
Normal sleep.
But once you don't get through the deep sleep, then your brain is not allowed to relax. During deep sleep, the brain prefrontal cortex releases some hormones. That is how it's supposed to be. Your brain is supposed to be at that relaxation mode.
You said some people after eating they'll go to bed straight. So how can eating and going to bed immediately affect our sleep?
Let me just state this. First, your food will not digest.
One, I love that.
And I know that people that do these things, they know too that they end up waking up in the midnight with running stomach and going to the bathroom, then being disturbed of bloating. These things happen. So they know because they feel it, so that if I go to sleep now, I'll be bloated by midnight. I won't be able to sleep. So it just disrupts everything, and once your digestive system is not functioning well and it disturbs every other thing.
Yeah. Something I understand about eating late and sleeping immediately is when you wake up in the morning, you feel as if you did not eat anything yesterday night.
There is a way you will feel.
You feel heavy, like you know that this is not you.
So it's advised to eat an hour before bed.
Or more than that.
But at least an hour.
Let's talk about adults now. Things that make them not to be able to sleep very, very well. Can depression cause this?
Yes. So depression and sleep, they are like this. They're like 5 and 6. Once you have anxiety, depression, it won't even be easy for you to sleep. So it's a two-way thing. The more you subject yourself to poor sleep, the more risks of anxiety and depression. And once you now have them, you won't be able to sleep.
Because the brain will not calm.
At all.
And once the brain is not calm, you are in trouble.
Yes. You even have emotional reactivity, like your
Someone will
mood
talk
swing.
to you, you will
Yes.
be like, what's that? Something you're not supposed to react to because you're not calm. Oh, I love that. A lot of doctors out there, they will advise you that 8 hours is very, very important, but they barely have 5 hours.
I must say, the ones that don't sleep, they engage in relaxing activities. They try to rest more. And when they get their sleep, probably 3 hours, they're up again. Or at least they were able to relax their mind.
So how can we help ourselves? Just imagine we have all these symptoms that we talked about. How can we help? What are things we can do? Can exercise help?
So there are things we can do that can help the whole sleeplessness. So we have engaging in relaxing activities before
Like
bed.
what?
Like yoga.
Okay.
It's not rigorous exercise.
Okay.
In fact, it's advised that rigorous exercise should come way earlier before bed. Reading novels, listening to calm music, chatting with one's loved ones, avoid alcohol before bed.
In Africa, that's 95% of people that take alcohol today like to take it in the night.
The best route is just to avoid it before bed. Avoid coffee before bed. Invest in a supportive and comfortable sleep system, like good mattresses, good pillows.
How many years is it advised for us to use our mattress? Because some people have been using their mattress for the past 15, 20 years. The fact that they can still sleep on it, they don't know that bed can cause issue.
The thing is, once you start feeling discomfort, some mattresses, the brands are better than others, like you can't really compare. But once you start feeling a depth inside of it, you should change your mattress.
Some people, they will sleep on the mattress.
Even pillows.
And they are inside the mattress already.
Yes, some people is depth.
You see some mattress, you'll be like, are you serious? They are inside the mattress already.
Yes.
But the fact that the mattress is still okay, they'll be like, we'll manage it. Some will still change the side.
Some people, because their sleeping system is not good enough, they have poor sleep. Some people, screen time, they are always on their phone in their bed, and it is not even advisable. Being with your phone in your bed during bedtime will expose you to light. It will reduce the time you're supposed to fall asleep. and it will also reduce the release of melatonin. So it's just like signaling your brain, and your brain is releasing, okay, it's not yet time for me to. The brain is still active, the brain is still working. Let's wait small. Before you know it, you're finding it very hard to sleep and you stay awake all night.
Can we say diet too can cause?
Not sleeping.
Can diet cause it? Maybe you're not eating an healthy food.
It's possible. If you're not eating something healthy, your body will not be working the way it's supposed to work. You might feel okay, maybe you're trying to lose weight or something, but you're always very tired. Even to fall asleep is difficult, and when you end up waking up, you are also very tired.
I used to have a lot of people that will say, I wake up this morning, I'm very, very tired. I feel as if I work overnight.
Your brain has not rested.
Some will say, my doctor said I should take a lot of water.
Your brain has not rested. Some, they woke up in the midnight in between, probably to ease themselves, and they quickly pick up their phone, check Instagram reels, check YouTube. Then they expect themselves to go back to sleep. No.
People that urinate frequently, like 6-7 times, and this one affects their sleep a lot.
Okay. The thing is, it's imposed by the frequent urination. So once you have to get up from the bed to use the toilet and coming back, it's quite disturbing. Trying to fall asleep in that short period, then you are feeling like going back to the toilet is quite disturbing. So we have to find a solution to the frequent urination first, so it won't disturb sleep. Once there's a disturbance in sleep, it's very difficult to go back.
And some, they can sleep on a bicycle.
If it's consistent.
Is it a gift?
If it's consistent, it's a sleep
disorder. Can you
disorder.
sleep too much? Is it possible?
Yeah, sleeping too much is a sleep disorder.
Because some people that watching us to be like, me, thank God, me, I'm not there. I can.
Some people sleep during
inside
the
water.
day. They sleep at night. They don't even feel tired of sleeping. If it's consistent, it's a sleep disorder. So that's how you can differentiate sleep disorders from maybe something that happens just once in a while. You will see it happening like a pattern. The same, this thing is happening, I can't sleep. This thing is happening again, I can't sleep. This thing, then you have to see a doctor.
Is it only at night we should sleep, or we should sleep in the afternoon too? Is it normal?
Okay, taking a nap in the afternoon is necessary.
Not nap. Some people sleep like 4 hours.
Yeah, some people sleep in the afternoon.
Yes, they will be like.
But the reason I'm using nap is because people that can't sleep, they can rest in the afternoon. And if your work schedule does not permit you to do that, it's still fine. But try to sleep at night. I won't say it's not compulsory, but it's necessary.
What is the cause of snoring? Do you know snoring has caused a lot of people their marriage?
Yes.
That the other party will not take it lightly, and they won't be able to bear the sound. What can they do?
Yes, so most times snoring is caused by obstruction.
Okay.
If the airways collapses on each other, then the air will not be able to come out. Sleeping positioning can cause it. The kind of pillow you use, if it's someone that uses pillow before and the pillow is now flattened,
you are using foam
placed your neck might be placed in a way that will cause snoring. So in our place we sell CPAP.
Okay.
And it also helps in reducing snoring with time, because you have to be placed on it for a while, and consistent use will help reduce or take it away.
So there are solutions for people that snore.
Yes, a non-invasive solution.
Yeah, if you ask people, they will be like, it's people that have big tummy that used to.
No.
Yeah, I've seen a lot of people very slim and they snore.
If you are tired,
yes, you will
can snore. Because you will not even mind the way you are sleeping on the bed. You'll be restless on the bed. Even children snore.
What are things we can do to solve this sleep disorder? In your place, do you have things that you offer to help?
Yes, there's one effective way that has been helping people, and I'll say this should be the first step they should take in solving any sleep disorder. After avoiding all of those things I mentioned earlier, then you create a consistent sleep wake schedule.
How do we do that?
The time you have to go to bed, if it's going to be 9 p.m. every day, make it 9 p.m. every day. The time you're going to wake up, you can set an alarm or make it 6 a.m., 7 a.m. Make it consistent.
One thing about brain is if you're used to 6, waking up around 6,
it won't even be difficult.
Your brain will wake you up.
Difficult. You won't be feeling very tired in the morning. You just get up and fine. So make a consistent sleep wake schedule. And if that is not working, then you have to come in to us for a consultation.
When do we need you? When? How can I know that I need to go to Rivonia?
So from most of our discussion, I've been mentioning something consistent. Consistent means like a pattern. We have 7 days in a week. It happened like 6 times. The following week, it happened 6 times to 5 times, 6 times. What was happening? Following week, same thing. And you try to check yourself and cut down those things that you know that might have caused, and it's still happening. Then you have to see us.
Finding it difficult to sleep can cause what?
It will cause mood swing. Number one. Then there will be high risks of depression, anxiety,
high blood pressure.
Yes. Your body will not even relax. Your brain will not relax. You feel very worn out. The way you relate with people, there will be poor communication, and even if you have to communicate, it's not going to be clear. It's going to be very harsh. Behavioral patterns will change.
It's a sign that the center of nervous system is
not relaxed. It's overactive,
Yes. And without the brain, our body is useless.
Yes.
I'd like you to give us what we should expect while coming to your side.
Okay.
Because a lot of people are facing things like this and they need help. They've tried a lot of therapy and it's not working for them.
Once you come into our place for the first time, you book a consultation and you'll be attended to. We'll give you a maximum of 2 weeks monitoring, and we'll know if you'll be placed on a polysonogram or you're going to get a CPAP machine, which we also sell. So we have a very conducive sleep lab. If you are to be in the sleep lab, you're supposed to stay overnight there with monitoring, of course, and we have a comfortable sleep system. Rivonia Diagnostics and Sleep Center will definitely give you the best. We work towards a better health and will surely deliver to you. So you should come to our place and see for yourself.
Okay, so imagine I'm coming. Did I need to bring anybody else with me?
Yes, it's advised that when you're coming for a consultation, if you have a spouse, you're supposed to bring your spouse, because there are some things that you might not know you're doing during sleep that your spouse will be able to tell, or someone that lives with you, that sleeps with you in the same bed.
If you are coming to Rivonia Diagnostic and Sleep Center, how can we locate the place?
I think a popular landmark in Ibadan is Challenge.
Challenge, okay.
So if you are coming from Challenge, you can board a taxi or a bike to Mobile. It's not far from there. So when you get to Mobile, Oluyole, you can board a bike or a taxi to Rivonia Diagnostics and Sleep Center. We are at Blue Gate Junction, adjacent Friendly Top filling station.
Okay. Do you have a phone number that we can?
Yes, you contact the phone number below the screen.
Okay, all right. Thank you for showing up. And I'm very happy because our people will be happy to watch this video. Don't forget to like, share, and subscribe to our YouTube channel. We'll see you in the next episode. Thank you.